Hey everyone, welcome back to your anatomy lab. In this video we're going to go over some of the blood vessels that you need to be able to find in your lower extremity. So we're going to start here on Vinny, and we're going to check out some of his arteries and veins. So for this week you need to be able to find the external iliac artery, and that's this thick artery right here, and we're going to follow this distally and distally and distally, and it'll eventually have a name change, and then we're going to call it the femoral artery. And then we're going to continue following the femoral artery distally, 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 until we're going to have another name change, right? This one right here, we're going to start calling it the popliteal artery. So if you remember, popliteal means that region behind the back of your knee. Some of the structures that you can look for to help you find the name change is the hiatus. And now the hiatus is going to be like a hole that you can find inside adductor magnus. And so when you see this femoral artery dip behind or through that hiatus, then we're going to have that name change right here, the popliteal artery. So once we've got this popliteal artery, right, look for it in the popliteal fossa. This will then divide again or branch again into a couple of different arteries. So we're going to follow this one forward or anteriorly, and this artery right here with this name change is going to be the anterior tibial artery. And you can follow this all the way down to the surface of the foot, and then this loop structure right here, this is the dorsalis pedis artery. And this is definitely really easy to find on the models, right? Look for this like really specific loop structure. All right, and then the other artery on this side that you need to know is the posterior tibial artery. So that's this artery that's going to go medially and posteriorly, and it'll hang out around that medial malleolus of your tibia. Not too bad? Okay, so now that we've got all the blood this way, we need to bring the blood back. So let's look at drainage for the lower extremity. Thankfully, there are only a few veins that you need to know for this week. We'll start with the biggest and probably my favorite, great saphenous. So that's this really, really large, really, really superficial and really, really medial vein, the great saphenous. It drains into femoral vein, and so this is really, really easy to find on the cadavers, really, really easy to find on the other models because it's just huge and medial. Okay, so if I move a little more inward, we've got that popliteal vein, which you can expect to find in that popliteal fossa. And then if we keep traveling proximally, right, we'll have the femoral vein, and this follows the same nomenclature, right? When we see it pass through that hiatus, we can give it a name change, and we'll follow this femoral all the way up until it and the saphenous kind of merge, and then eventually we're going to have another name change at that inguinal ligament to the external iliac vein. Okay, thanks for working hard in this class, and we'll see you again soon.